Great, and we'll get started in just a few minutes. We're going to let some other folks join before we start here. Probably start around 12:01, 12:02. Welcome again to everybody that's joined. We are going to get started in just a few minutes. Let a couple more folks join. All right, let's go ahead and get started. So hi all, welcome to O3's webinar, Transforming Health and Wellness Through CX, Best Practices and Strategies for Improving Patient Satisfaction in 2023. My name is Maddie Boucher, and I'm a digital marketing strategist at O3. Thank you for taking the time to be here today. Let's go ahead and dive in. So looking here at the agenda, here is an overview of our flow for today's conversation. As a quick note, we really encourage you to share your questions and thoughts in the chat. We're excited to hear from you, and we'll open up the floor following the presentation and panel. As a quick housekeeping note, we'll share this recording following the webinar. Feel free to pass this webinar link along to any colleagues you may see fit. As our let's meet our moderator and panelists for today. Ban Ku is an emergency physician and healthcare design pioneer who is changing the way medical professionals think about patient care. Dr. Ku's passion for design thinking in medicine began when he realized that traditional medical education did not adequately prepare him for the complexity of patient care. He recognized the need for a more human-centered approach to healthcare, one that placed the patient needs and experience at the forefront of medical decision-making. To bridge this gap, Dr. Ku created the first design thinking program for medical students at Sidney Kimmel Medical College, where he is the Marta and Robert Adelson Professor of Medicine and Design, the Associate Dean for Health and Design, and a practicing emergency physician. Through this program, medical students are taught to think like designers, approaching patient care with empathy and creativity. Dr. Ku also directs Thomas Jefferson University's Health Design Lab, a research group that explores the intersection of healthcare and design. The lab focuses on medical applications of 3D printing and the design of healthier communities, working to create innovative solutions for healthcare challenges. So welcome, Ban. And next we have Bonnie. Dr. Bonnie Offit, a digital and telehealth advocate, is passionate about using technology to improve healthcare delivery and empowering patients to take charge of their health. Dr. Offit brings a wealth of experience to the conversation. She was the physician lead in the Office of Digital Health at Children's Hospital of Philadelphia for the past 5 years, where she played a pivotal role in scaling telehealth across all departments in response to the COVID-19 pandemic. During her time at CHOP, Dr. Offit also implemented a free school telehealth program in an underserved school district. Dr. Offit has extensive experience in pediatrics and digital health initiatives, and she has brought her expertise to self-care decisions as the Chief Innovative Officer, where she is focused on harnessing technology to innovate and grow the company. As a technology provider, Dr. Offit understands and values the opportunity in digital health solutions. Among her highlights are extending the company's triage symptom checker to provide diagnosis, enhancing its offerings for patient portals, supporting chatbot content delivery and configurations, and integrating symptom check encounters with telehealth call centers and EMRs. So welcome, Bonnie. And last but not least, Mike Gadsby is a founder and Chief Innovation Officer at O3. He spearheads identifying new processes, products, and services we provide our clients. And in the last couple months, Mike has made generative AI a primary focus for O3, as well as driving a new focus on patient experience. Mike leads his team to focus on understanding our clients' business needs and customer life cycle to identify key friction points that are ideal for innovation. He regularly runs innovation workshops and speaks on topics ranging from CX and digital transformation to automation, AI, and personalization. Thank you all for being here, and we're really excited for this conversation.
Thanks, Maddie. Appreciate the intro. So I'm going to start by just laying some groundwork for the conversation. So first of all, just a little about O3. We are customer experience consultants. When we say customer experience, though, we're really talking about human experience. We're really talking about, everyone from customers to employees to administrators. And in this case, we're talking about patients and the healthcare experience overall. The work we do at O3 is really to map out and understand those journeys, really understand where the gaps and the opportunities lie to really help to inform new opportunities to improve those experiences. Generally, that's through digital innovation, but often that's simply through having discussions like this and really figuring out where those biggest opportunities are that we could take advantage of. So we're excited to have you. Excited to have Bon and Bonnie here. It should be a good conversation. So again, I'm gonna set the stage here to begin with, and just talk a little bit about the topic and some of the key issues we're going to tackle. So let's just talk about patient experience overall. And think about patient experience as it relates to sort of the overall human experience. This is something that affects everyone. At some point or another, you are going to be a patient. A loved one is going to be a patient. A doctor will be a patient. So this is actually a problem in a space that really is important for us to identify sort of across the board. But here's the thing about the patient experience. Oftentimes we think about it as the relationship between the patient and the healthcare provider. The reality is it's a lot more complicated than that. You have a lot of players involved in the mix that really help to inform the overall patient experience. Of course, insurance companies play a major role in that. But if we think about the larger ecosystem, everything from the hospitals and the healthcare establishments that we engage with, to the administrators that we have to engage with to schedule appointments, that sort of thing, right down to the pharmacies and the testing facilities that we have to engage with as well. And I'm sure there's probably 80 other touch points here that I haven't touched on, but are really important. And why it's important to focus on this is because this complexity is what creates sometimes friction within the overall patient experience that we really need to identify, explore, and begin to alleviate some of those pain points. I'm going to tell a quick story that I think sort of summarizes a lot of that complexity in that experience. This past fall, my son, who plays soccer, was injured in a game. He was running down the field. He was on a breakaway. He was about to score a goal, and boom, something popped in his hip and he hit the ground. Now the thing about this is the second time he's had this injury. He's 14, so he's going through a pretty big growth spurt, and grew about 6 inches in the better part of 18 months. And because of all that, his body was stretching out, and a lot of these things begin to happen. The interesting thing about this, though, is, we took him to the hospital. And again, second time it happened, and he was crying because he knew what happened and he knew what this meant as far as, not being out for an extended period of time. You sit down, the doctor comes in, we tell the doctor exactly what happened. We said, hey, it's probably this. Doctor says, okay, go get an x-ray. Doctor comes back and says, this fracture, which we thought it would be similar to last time, says, I'm not seeing that in the x-ray. Hopefully it's nothing, it's not too complicated, and that's not going to be the case. So the doctor sets us up with someone to go see at Children's Hospital, as any parent in Philadelphia generally does. We go down, and we see an orthopedics physician at Children's Hospital. He takes one look at the x-ray and says, yep, it's the same thing, right? Which in and of itself is fine. Although we had, my son had started building up hope. Hey, maybe this is only a thing. I'm only going to be out a week or two, and that'll be the case. And this obviously shattered that idea and sort of brought him back down to earth. The other thing that started to happen was you started to have conversations about, okay, well, what happens next? What are the things that I should expect? The doctor was fantastic. Doctor told him everything he needed to know about his hip, his injury, and what to expect. But as the doctor left the room, my son began to cry. My son's a pretty stoic kid. This isn't one of these things that really he does on a regular basis. But missing his soccer season, particularly in his 8th grade year, was something that he was really, really upset about. So managing his mental health on top of managing the injury was something that, was a bit of a gap, was definitely something that we had a problem with. Moving forward, as he began to go through treatment, we had to start to schedule the appointments with a physical therapist and do all that. I'm on calls trying to figure out what I need to do to have him looked at. Okay, what kind of treatment does he need here? Does he need to come back to the doctor to get another x-ray? Really coordinating between all of these various entities to really get to a solution that made sense for him. Took a lot of time out of my day, a lot of effort, and a lot of energy. And the reality was, this was all stuff that, frankly, we have to re-explain the situation every time we come to a new physician. We have to dive into the problem again. We have to get them to examine him again. We have to, at one point, I had to get the x-rays from Children's Hospital on a disc and bring them to another doctor's office so they could take a look, right? All sorts of challenges and issues. Now, luckily, overall, his situation improved. He was able to get back out there for the last few games of his middle school season, and it was great. He scored a goal in a playoff game. At the end of the day, not the worst thing in the world. But the reality is that healthcare experience, while at the end of the day, it treated his injury, there were a lot of gaps. There were a lot of opportunities here for us to be in a better spot as a family, for him to be in a better spot as the patient. And then overall, just a lot of the communication that we were experiencing, or the lack of communication, was definitely something to look at. The thing about this story is this is like everybody's stories. We all have these stories. Somebody gets hurt in your family, you get hurt yourself, you get sick, something occurs. We have a whole slew of people involved in this situation. And this is really where a lot of the challenges in the patient experience start to come into play. So let's talk about the areas of focus for today. So there's really 4 key areas that we're going to touch on, that we're going to dive into these in various aspects, and we'll sort of explore these in their own right. But these are the 4 we're going to talk about. So first is the move to a digital experience, right? This became far more prevalent as the pandemic came into focus, but certainly was in play prior to that as well. The move to treatment like telehealth, right, where I can get healthcare in my home versus having to go and get out and actually see a physician or some sort of healthcare provider, is a big deal. And that move to the digital experience is not only to take advantage of these new technologies, but really to make the experience better, because in a world where I am a click away from buying a product, I should have a similar experience in my healthcare experience. The issue there, though, is what that sort of starts to create as far as reach and service quality is concerned, sometimes creates disparity across the board for many patients. Some people have access to this, some people do not. So then your treatment levels start to become a little bit different depending on who we're talking about. But the opportunity to create more reach, better service quality across the board is definitely something we want to explore and dive into. Of course, underlying all of this is data. Data is a big topic in healthcare, and not just because it sort of is key and crucial to really creating these great digital experiences, but because it creates a lot of security and privacy issues. HIPAA and regulatory issues come up with this constantly. And now we're talking about the use of AI to really help to identify things like symptoms earlier, to help treat patients earlier in processes. Well, we need access to data in order to do that. But those security concerns and those privacy concerns are definitely something we want to explore. And finally, this all really comes down to, as you saw with the complex graphic of individuals and entities involved in the healthcare experience, around silos in healthcare. We have healthcare institutions that don't necessarily talk to each other. We have data that sort of lives in one spot but not in another. The fact that I had to go get a CD with my kids' x-rays on it and bring that to another doctor is just mind-boggling to me when we have a cloud now. But there's a lot of reasons for that, and there's a lot of risk in having them have those images up in a spot that you know, anybody can go get to. So a lot of these are the areas of friction that create a challenging patient experience. And overall, these are the areas of focus for today that we're going to dive into. So let's hop back into our panel here, and Bon and Bonnie, thank you so much for joining us. I'm going to stop sharing my screen and start hopping into some of these questions now. But the first one I really want to dive into, and Bon, let's start with you. I really just want you to help us determine what makes a great patient experience, and maybe what makes not such a great patient experience.
Thanks, Mike, for that intro. I feel like we could spend the next 3 hours on just one of these buckets. So, you know, talking about the patient experience, and, you know, when I look at the healthcare system, the system was designed to optimize our terrible experience. Because what you're talking about, the system is siloed, the system is complicated, and it's designed to not give us a good experience. So when we think about improving the patient experience, we need to step back to the origin story of like how the healthcare system was designed in the first place, and to really dig into that, because we're in an important transitional period right now, as you're saying, Mike, when we're going from analog to digital, and that's happening in every sector of business. And when we look at healthcare, as things move to the digital space, there's an opportunity here to redesign the system. So it's really important that we get it right, because as we're creating these digital services and products, there is a danger to repeat the same mistakes that we have in the past, and continue doing what the healthcare industry has always been doing. You know, we're very siloed, and I have some optimism when we're thinking about the future of healthcare, that through design, there is an opportunity to improve that experience, both for patients and clinicians. So those are kind of my opening thoughts, and we could dig into as many tangents as we can going down this thread.
For sure, for sure. I think you're hitting on some things, particularly the transition into the digital experience. And anytime you talk about change, and when we think about change within organization, businesses, right, there's always this idea of change management, but the scale with which we have to manage that change is the challenge, right? When we're talking about healthcare. Bonnie, the work you're doing at Self-Care is really interesting. And I thought you could speak to that a little bit, and how you guys are starting to address some of these changes into that transition into digital experience. And maybe within that, you can address as well the same question, is how do we make great patient experiences through all this?
Yeah, sure. Thanks, everybody. What we're doing specifically with self-care decisions is that first moment that you have a new symptom. So we entered the healthcare system in various ways, but often, like with your son, Mike, you know, he had an injury. So you have a symptom, an injury. Where do I even get started? Get the phone? Where do I call? The symptom checker can help, because it's on, you know, it can sit on your phone, sits on a mobile device. 80–90% of us now have smartphones, and you can go in and get like in 2 minutes, you could put in, you know, hip pain, and get a sense. Should I go to the emergency room? Should I go to urgent care? Should I go to, you know, primary care? Like, what should I do? Because you feel like you're a little bit in a panic. The other thing, our symptom checker and others can do is also give you some great tips right up front to do what you can do at home while you're waiting and trying to figure the whole thing out. So you're already starting that adventure, or I shouldn't say adventure, but that whole journey you have when you have an injury. A lot of times you just go right to Google and you're searching, like hip pain, leg pain, whatever. Sometimes it's nice to have it a little bit more distilled and given to you from a very, reassuring source, like your own health system or your own doctor. And that's what a symptom checker can do. So we think it's a nice little way. I mean, and I'll go back to good and bad experiences. I mean, we now talk about, in this digital age, we talk about digital doors, right? Front doors, whatever, back doors, side doors. But that's like, how do you enter, the healthcare system? And it's still pretty much phone calls, which feels a little old-fashioned and a little old and super frustrating. As a pediatrician, I mean, this has been going on for decades. How incredibly frustrating it is on a Monday morning or whatever day, but mostly a Monday morning when you've been up at 2 a.m., your child's first fever, and trying to call and get someone to talk to on Monday morning at your pediatrician's office. So as Bon said, we have like huge problems. So there's loads of bad patient experiences, and my own personal, I'll just give my little fantasy great experience for that example. Going digital, I have a new baby, I have pretty good experience, not great. It's like 6 a.m. I'm trying to figure out what I'm going to do with this fever. I can go to my symptom checker. Then if my healthcare system has a symptom checker like that, it'll guide me. This is just a fantasy, by the way. I don't know that everyone's doing this yet, but my symptom checker then tells me, because my child's a little older, I could actually do a telehealth visit. My problem is appropriate for a telehealth visit. So then I go in and I'm going to my patient portal. Let's say it's Epic driven. You get an option to actually make an appointment. You can make your own self-appointment, make the appointment for, let's say, 2 hours from now. So you never leave the house. You can use the symptom checker to tell you what kind of things you can do at home at the moment, when to worry, when not to worry. I'm reassured by my symptom checker. I wait for 2 hours later. I get my telehealth visit. And that's my ideal great experience. So I'll stop there.
I think you sort of hit on a lot of interesting things there. And one is, you're not leaving the comfort of your home, and you're dealing with a problem in the moment you're having a problem. We've all been there as parents anyways, where, especially that midnight, fever is one where you want to contact somebody immediately. I don't want to wait 15 minutes for the call back for the doctor who's on call that night. But like, there's humans on all ends of this problem, right? They also have a life and they have to live that life as well. One of the things I want to hop back to, in a word you use, which I thought you'd sort of reel back from, but the adventure of healthcare here, I think is one to really explore and to dive into further. So let's talk a little bit more about the digital experience. Bonnie, I thought you did a nice job there of really mapping out what an ideal journey would look like. But that journey we're far from that. And there are a lot of issues to try to really engage with to get there. I think personally, one of the biggest problems is really the fact that a lot of those experiences aren't really created with the patient central to the conversation. Bon, the work you're doing in education really is built around design thinking and design thinking processes, which is typically built around, what's considered human-centered design. So I'm curious from your point of view, how we bring the patient back to the center of this conversation and how we can start to really devise solutions that really have the patient in mind versus, a lot of the other entities that I mapped out seem to kind of come first often.
We can apply this principle of co-design into our creative processes when we make products and services. So inviting patients, caregivers, their communities into that design process from step one. And it's a hard thing to do, right? Because it's easier for a clinician, for a company to create a product in a black box and then to release it out into the public and then to get feedback. Sometimes they get feedback, sometimes they don't. But what would it look like if we brought in patients, caregivers from day one of the design process, and they are active members of that team that creates products and services? I think you can see a big difference in what that experience might look like. Because as it helps us to build empathy for the end user of that product or service.
For sure. And let me ask a follow-up question to that, because I know you've been running this program for a while, and particularly with doctors or med students, their idea of the world that they're getting in. I'm not a physician, so I really can't speak to this, but I have to imagine the idea of taking a point of view that is design thinking centric and really bringing the patient back has got to be pretty altering for their approach to medicine, then moving from there on out. I'm curious if you can speak to some of the outcomes or maybe some of the experiences you've had and how that is different for the medical professional who's sort of coming out of a program like that, and what that means for their own development.
Yeah, in medicine, we have this history of the master clinician, right? It's a very patriarchal pedagogy that we come from, that we are the experts. And then, we'll get some patient feedback here and there that's like, sometimes we solicit that, sometimes we don't. But, I really think we can deliver better healthcare when we invite patients into every step of the design process. So when we are thinking about designing a new experience, for example, or like designing a new product, like redesigning the IV pole, that right, to bring in patients into that process is a very humanizing one. It helps us build empathy for our patients, and not only for patients, but kind of developing empathy for the human, because patients are more than just their disease. And if we peel back the layers, that we understand that there's all these other non-medical factors, their neighborhood, their job, access to food that impacts human health. And you can't do that. You can't understand those nuances until we bring patients into the design process.
It's interesting because you're making it sound like that's like the greatest idea ever. And I do think it's the greatest idea ever, because it's a lot of what we do on the commercial side with, things like financial products and insurance products. And it's very similar. But
yeah, we just do it 10 years later in healthcare.
That's what I'm saying.
A little bit slow.
We just haven't gotten there yet in healthcare. Bonnie, why don't I pass this one over to you, and maybe you can talk a little bit about what you guys are doing on your end. But like, why is it so hard to bring patients into the conversation, to make this human-centered? I mean, we're talking about, as I said up front, something that literally impacts everybody. Why is that a challenge?
Yeah, I just think it's the system that, like a little bit was Bon was saying, it's sort of what we have a healthcare system, and it's sort of just a little bit old and traditional, and we do what we do, and we're not great with change. It's just not a great change machine. It's just so big. Sometimes a teeny little private practice might be able to make some changes quickly. It is just a really sluggish thing. So my little ideal scenario I was talking about earlier, you have to create a whole provider, like a service line at a hospital. Let's say a Children's Hospital of Philadelphia. I now need to hire, 10 new physicians and figure out how to pay them. And they're going to be sitting there on call and take these telehealth visits or whatever it may be. And we're just really not great at making these systems work. Of course, as everyone's saying, is this really what the patient wants? I mean, there's ways we know what does the patient want. One is because, as you said, Mike, we're all patients, so I happen to like technology. I can't stand trying to just sit on the phone and wait forever, but there's still some people, usually older people, but there's some young people that just would prefer to just get on a phone and call their doctor. So to me, I still think you need to offer all options, and I think we can learn that from our patients and do test groups. My experience with Children's Hospital of Philadelphia, we've done a lot of pilots, pilot. Before the pandemic, did a few during the pandemic. We had a really cool one in urgent care in the middle of the surge. We offered patients a telehealth visit once they entered the door in a little room in the back, if it was a really low acuity problem. And that all our pilots are pretty successful, but we can't seem to make the leap. Okay, let's now do the program. So I don't know. There's just a lot of things going into it, but I do think pilots are really, really helpful to try to figure out what the health system can do, what the providers want. But I always feel like the most important thing is, what do the patients want? Now, the patient may want different things. You've got different patients who want different things, but what is a group of patients? What do they really want? And we need to get better at that.
And just to advise some of the audience who are designing products or services that it's important to design feedback loops into the system so they can get continuous feedback from the users. It's very frustrating when you're using a product or service and you go, hey, this sucks, and it never changes. And I think there's a responsibility for companies to measure the impact that they have, if they're doing a good job or not. As physicians and researchers, when we look at a new device or new medical procedure, we study that. There's evidence behind that. Does it work, or if it doesn't work? And we get feedback from that. And I think companies need to do the same thing. If they're launching a new product, that it is their responsibility to measure their impact in a scientific way.
Or somebody else will. And they'll move on with it, right? I mean, it's that simple. And so I think this is really interesting. I think one of the topics that I definitely wanted to dive into, which I think starts to segue into this, is I think one of the challenges, and we're talking about qualitative insight, right? We're talking about data that is provided by patients directly. But I think one of the key aspects of the healthcare experience over the next several years is going to be the hard data, the actual data of patient care, and the actual physiological data that we're using for research, which I think more than any other industry, I think that these are areas where we can really see a lot of progress and approach. But data is definitely feels like something in healthcare that's a real challenge to work with, right? I mean, it definitely, between regulatory issues, between some of the privacy concerns, et cetera, while it feels like we have more tools at our disposal and honestly more data at our disposal, it feels like people are less inclined to do so. Bonnie, I'm going to come back to you only because we had this direct conversation as part of the prep, which, and you said something that I thought was really fascinating, which is that a lot of these healthcare systems are actually afraid of data. And I think there's an interesting point in that. But can you speak to a little bit about just data overall, your thoughts on it, and then maybe even comment on that point so we can dive into the topic.
Yeah, I mean, I guess data is many different things, but let's just talk about like Fitbits or, your watches and EKGs, or, things flowing in from patient wearing something into, let's say, their patient portal. Who's going to look at these things? I think hospitals and legal teams are just really scared to death. What if some event happened, or they just didn't pick something up? Or all these messages coming in. Let's say your portal messages, people type in all the time, my child's having trouble breathing, what should I do? Even though there's 100 messages saying these aren't for urgent things, we're supposed to wait 2 or 3 days. So all of a sudden that's now part of your healthcare record. Now you've got like this thing sitting there, and it's a little scary. In medicine, we need to take care of the patient. What if we missed that message, didn't get back in time? We missed an AFib run, on the watch. So I think it's just a huge barrier as to wanting to let all these things in and to try them and practice them and do trials. Everyone's scared to death, especially the lawyers.
Right. But on the flip side, all of that information could result in a lot of really positive outcomes. I think one of the, especially with the rise of ChatGPT and generative AI and all of this, one of the most interesting use cases I saw was they ran it against mammograms, and there was they had looked at a couple of patients, cancer patients who had obviously had issues, and they discovered that the AI could actually see the problems a year prior to when it was finally diagnosed, which I thought was fascinating. But that's the sort of thing we're talking about. We can leverage data like that to actually solve these sorts of problems. It's a big deal. But to your point, you have to have access, and you have to have it centralized. You have to have it in a spot that everyone can actually work with, and that becomes a challenge. Bon, I throw it over to you on this one. Thoughts on this front?
Yeah, I don't think we're going to see improvement in this space until patients own their data or co-own their data. Where's the data stored? It's stored by health systems, insurance companies, medical device companies. If you ever had to fax your doctor to get a report, that is symbolic of you don't own your data, you don't co-own your data.
Yep.
And we really need to come up with design principles of how to manage data, who owns it. And currently that's, it's a power differential because patients don't co-own their data. They can't, I can't just delete my medical data and get rid of it because it's owned by other entities out there. I should have that right to do that. I think I should have that right to take my data somewhere else and have access to it in real time because I produce that data. And I think until we develop these principles around data ownership, we're not going to see major advancements in this space.
Yeah, I like the thinking there, particularly from the standpoint of it also helps to create trust when the patient owns the data. So some of the legal concerns, and Lord knows, I don't think anything's happening with a lot of those legal concerns, but I think you start to move towards a solution on that front because patients themselves then are empowered to make decisions versus my situation with my son having to run down and go get is x-rays off a disc because I don't have an easy spot to go get that information, right? That's really interesting. So back on that topic though, I'm actually interested in this from an educational standpoint now as well. So how's data being leveraged in terms of medical education these days? I mean, how data savvy are new generation of healthcare providers, or even the old generation of healthcare providers, and what's the expectations around that?
Data, medical knowledge, it's overwhelming. There's too much there right now. I mean, a physician can't do their jobs because there's too much data. We need better tools to manage that data. There's a recent study done that showed, over 50% of the text in electronic healthcare records is duplicated because we copy and paste all the time. And if, for those of us who see patients and it's hard to get some information right on the patient of, hey, what antibiotic were you recently on for urinary tract infection? And again, it can take a long time to figure out that key piece of information. And, I think we need to come up with better tools so we could mine that data quickly and give back time to the patient and their clinician.
I am curious though, is that a reality? Is that something that could actually occur given the complexity of the system?
Absolutely. I mean, when I started, I used paper medical records. So electronic healthcare records are 100x better than that. And there are all these sophisticated tools coming out. We just need to get it right? We need to develop what are those ethical principles, that when we're designing these AI generated products. When I entered into medical school, I had this ethical principle of do no harm. Right. And are we demanding that of these solutions that we're seeing by companies that are being produced?
How about at a higher level? And Bonnie, I'll throw this over to you as we start to think about some of this change. I mean, these systems, as you guys mentioned earlier, are sort of steeped in the way they function. I mean, you have so much, organizational debt to essentially deal with before you can really start solving these issues. So the siloed nature of the experience seems like it'll persist without some higher level, I don't know if it's governmental or what, to help to sort of streamline some of what is happening across that experience a little bit. I'm curious if you can speak to that. What really has to change in order to really break down those barriers and those silos and really help to create just a better patient experience?
Yeah, I mean, one thing I think Bon hit on this. I think if I owned my own health data and I had all of it just on my phone in a very organized fashion, I have my problem list, my meds that I'm on, who my doctors are, my most recent x-rays, I'm going to be a much better steward of my own medical information. I'm not saying everyone should do that, but I think it's a huge start, because if you were taking your son and you had that x-ray on there, and you own it. And I think that would be the biggest, quickest way to sort of knock down a lot of these barriers. because then you also don't get into all this privacy stuff. You're having to, 3 times authentication and releasing records from one place to another. It's a mess right now. I mean, but I've lived through this whole transition like Bon. I did paper records, which were the best. They were the best. You just flipped open, you saw an updated problem list, and you just knew the patient. And then 30 years later, I'm in the, an emergency or urgent care section, and I can't, it's so cluttered. There's so much stuff on that medical record. I can't get what I need. The most important thing, the patient has some huge medical problem, and I don't even see that like right away. But it's also humans. Someone didn't do that patient's record correctly. They didn't do a great problem list. I think we're getting better at that. But we're living through just that transition of going from paper, we're still living through it, paper to electronic records. I still think we're like maybe 2/3 of the way through trying to figure this mess out. And I think it was part of, they talk about physician burnout. I'm sure that's why I left doing a lot of direct patient care and doing more just digital health and trying to solve the problems on the other side, because I just couldn't type well, and I couldn't keep up, and I couldn't do and find out what was wrong with the patient until I walked in the room. So I don't know, I could be wrong, but I'd be curious if Bon thinks the same thing. If you own your healthcare and you're the one carrying it around, it might be better.
Oh, 100% agree. And also, just to add to your point on physician burnout, patients can have a great experience if they're getting burnt out, if they're getting care from a burnt out doctor.
Yep.
Right.
It's 60% of us experience symptoms of burnout. There was a study that showed that family doctors spend about 90 minutes after they go home at night charting. They call it pajama time. These are unpaid hours that after a full day at clinic, right, that you go home after dinner and then you're charting for 90 minutes.
That sounds awesome.
And answering messages.
Exhausting.
Yeah. You're answering all these My Chart messages, which you've gotten. It's great that you have this direct access, as from the patient, but it's really hard for doctors to just keep up with that.
It's so interesting because from my perspective as a, lifelong patient, at the end of the day, when you're plugging that stuff in, you're just, I'm not even thinking about it. Right. And we talk a lot about it when we build a lot of digital products and processes. We're thinking about customer. The influence of the employee experience on the end customer experience is a 1-to-1. Happy employees make happy customers. Well, this is no different. If we can get doctors in a position to be happier, less burned out, and leverage these tools to help them sort of fill in the gaps, I do think that's interesting. So let me dive into that one stage deeper. Because one of the things I will say coming into this conversation is I kind of felt like, healthcare was stalled and the patient experience while moving to digital created a lot more problems than oftentimes it has helped. But Bonnie, I think your point about paper was awesome. It was sort of an indication of that, right? Like it wasn't, everything was easier back. Now we have all this stuff and it becomes more and more challenging. But what are the next big steps that have to happen? I think we touched on sort of owning the patient data. I think that's interesting, but let's maybe stick with the doctor experience. What do we need to do then to make the doctor experience better? How do we make it so that there isn't this level of burnout and that you have engaged physicians? Bon, you want to tackle this one?
One is we need to give back time. So what's the purpose of all these digital tools and AI in healthcare? It's to give back time to the human relationship. Because at the end of the day, healthcare, Mike, you had that big chart in the beginning of, how complex healthcare is, but it is complex, but at the end of the day, it's just a series of relationships, and any relationship needs time. So, what we've seen is it's very frustrating going in for a 15-minute doctor's appointment a year, and you're like, oh, the doctor just typed at the computer and barely made eye-to-eye contact with me, because there is no time for these human relationships as healthcare becomes more and more complex. And also, how do we design love and trust into the relationship? Because that's what these tools should do. There's a lot of mistrust going on right now. There's not that opportunity to care because there's no time. So we really need to design time for these relationships in healthcare.
think that's so interesting. We talk a lot about this when we think about the customer experience. We say it all the time. Like we're designing our relationships, and you're really trying to figure out how digital doesn't get in the way, but gets out of the way, quite frankly. So I think that's interesting. Bonnie,
Yeah,
do you?
I don't care about the digital tools.
Yeah, right. Exactly. It's just cool.
I don't care how they work. You know, it's like I have a car. I don't really know how it works. Turn it on and it goes from point A to point B. And like, I don't really care how these digital tools work as long as they give me more time with my patients.
Right. At the end of the day, the ideal digital tool is one that you don't even use,
Yeah.
right? Like you don't even have to worry about it. It's not even in your way. You don't have to type. You don't have to speak to it. You don't have to do anything. You can just have a relationship with a patient. I think that's a really interesting point of view. Bonnie, you want to comment on this?
Yeah, no, I mean, I'm like, the Jetsons for those that remember the show. So let's design the future product where before you even walk in the room, someone has got a little something in front of you where you've got all the pertinent issues of the day. What the patient's coming in and maybe they've prepared, use the digital product to say what they wanted to talk about or what their problems are. And you just get to sit down and talk to the patient and face them and not type and just have your visit and figure out a better way to document. It's probably going to be some natural language processing tool, but maybe you can find out before the visit exactly what you're going to need to kind of go over in the visit. New things may come up, but to sit in the computer and to try to look through things and to talk and ask all the questions you're supposed to ask from all these organizations that say you have to ask whether a parent has a gun at home and whether there's just too many things to go over in your 15-minute visit, but there's absolutely completely agree. The most important thing is the time that you have in the visit. My best days as a pediatrician were those days where I didn't have as many patients. Maybe each visit you get paid more, so you don't have to have 25 patients. It'd be great to have 12 patients in your day, and see them and talk to them and go back to the way it used to be. And I hate that saying because there's a lot of crummy things that used to be. So I'm not really saying that. But if you just had time with each patient, I think everyone would be much, much happier.
That's great, and that segues perfectly into the last question I was going to ask, which is really the future of the patient experience in the ideal state. And I think you sort of nailed it from your perspective. Bond, do you want to tack onto that?
Yeah, Victor Montori wrote this great book called The Patient Revolution, and he talks about an unhurried conversation. And I think that's what the future of healthcare should look like, that you could go in and have an unhurried conversation with the person taking care of you. I bet you very few of us have had that experience.
Well, at least not recently, that's for sure. And listen, I'll be the first to say, I mean, I think what the pandemic showed everybody, and this isn't just in healthcare, this is in education, this is in all sorts of sectors where, you have a stressed out customer to start with.
Mm-hmm.
And because of that creates a stressed out work experience. And there's only so much you can do before you burn out. And I think what you're talking about, which I am huge fan of, is how do we get relationships back to a point where you can let it breathe, let the conversation go, and like make sure that you're getting to know one another just as much as you are getting the healthcare you need. So I think that's fantastic. Okay, we got about 13 minutes left, Maddie. I was going to pass it back to you. Maybe we open it up for some Q&A.
Yeah, we have some great thoughts coming in. I will just get started with this one. Do you have any successful experiences about incorporating gamification in health medical mobile app to improve the overall patient experience?
Bonnie, why don't you take that one?
Oh, a little gamification. I've been to talks. I haven't personally put one in and had a patient get more motivated, but certainly I could imagine that adolescents, and they're out there. There's definitely a lot of, especially mental health tools and mobile apps that you just, if you're following things and kind of journaling that day and thinking about things, you get like fireworks and you get some new goldfish and whatever else that the app is going to give you, and you get immediate gratification that you've accomplished something that day. So I think there's a huge role for that sort of thing. And I think there's some really innovative products going on out there. I haven't seen them used every day, day to day yet. And maybe Bond has some experience in something like that.
Yeah, the point that I just mentioned before around, designing feedback loops into a product or system or service is critically important. I think whether it's gamification or other elements that you're using to create a product or service, that those best ones are going to have feedback loops designed into them. And in order for us to really iterate on products, so I don't make I don't make apps or healthcare apps. I don't use healthcare apps personally. So, but I know that's
Wow, we just opened up a big can of worms. Yeah. We'll get into that another time. Yeah. Well, if I can comment on it real quick, actually, we've done fair amount of work, and actually with especially with Children's Hospital, we've done work with Children's Hospital with their Office of Entrepreneurship and Innovation. And what you find a lot of times is a lot of these like gamification concepts are really native, particularly to younger audiences. And it's almost like they're not going to use the product unless they have that sort of feedback loop in some capacity or another. It's crazy to me, even watching how my children, we talk about the metaverse, and the metaverse is coming. Well, metaverse is here. And I'm going to tell you, in the next like 5 or so years, when my 14-year-old who grew up in the metaverse is, in college and has his first internship, and he's going to sort of expect that as a part of the experience. So the idea that there's scoreboards and that there's, some gratification at the end of an action, or that there's progress bars and that sort of thing. Yeah, I think you're going to see that more and more throughout the healthcare experience, and really just about any experience. I think it's already finding its way in.
We have another good question here. What are some tasks that doctors in a perfect world would automate through AI?
Everything. So, one thing is pre-authorization. So, doctors have to get on a call with insurance companies to pre-authorize like an MRI of your knee, for example. Like, why does a human need to do that? That just like looking at insurance status, seeing if that matches with the imaging modality. But if you look at the workflow of physicians, they spend a lot of time, they or their staff, on the phone trying to get pre-auth for procedures or imaging. Very frustrating. Like, you don't need a human. Take the human out of that, right? A human does not need to be in that process to deliver good care. And there's so many things like that in the patient journey that we can automate and take the human out, so you could give back time in that human-human relationship when a doctor or a clinician is seeing their patient.
Bonnie, you have anything to add to that?
I think that's exactly right. The first things to tackle are pure administrative things that take up a provider's time, physician or nurse practitioner or whomever. And there's definitely some pretty cool AI things. The next ones up are looking at moles and X-rays and reading, and it should always be checked next by a human. But to start, with some automated readings of things that are very visual, I think there's a huge role for that. I'm always intrigued. There's a device called TytoCare, which is being used in telehealth more and more. It's a little hockey puck shaped device that you could do a home telehealth visit with. It's just being started to use. We did it a little bit in our school telehealth program, but you put first of all, it takes the temperature, infrared, it looks in ears, it throws a big bright light. But the coolest thing is listening to the breath sounds back and forth while I'm like listening live. But they just instituted an AI component where they can distinguish, and I guess I got it FDA approved, they can distinguish wheezing versus just a normal breath sound. So that's completely cool. Could be a new student that hasn't really heard wheezing much, but it's also, a parent at home goes across, and then, I'm remote, and I can, listen to the breath sounds and get a little added information from this AI tool. Maybe wrong, but I think it's a cool idea. So, and then I'll even say with the symptom checker, I don't think there's a role quite yet for, too much of this new technology, because there's so much nuance and subtlety and symptoms and whatnot. But it could certainly, we could take the content we have in our symptom checker, which Dr. Barton Schmidt, who was well known in his day in pediatrics, that does all the information and teaches nurses to do call center, the right questions and where to go in an algorithm. That's what we use to create our symptom checker. That's how we've licensed it. But that same content could certainly be thrown at these bots and do an automated thing and help decide based on the symptom and the answers what's the best level of care. So anyway, I see a lot of interesting roles coming up.
Yeah, and just in the work we're doing with GPT, I mean, I think it's a perfect use case, actually, what you just sort of brought up. I mean, training these bots with that specific type of information and then having them sort of extend beyond that. Yeah, that's huge. I think that would be big. Cool. Maddie?
We have a great segue question, actually. So are there any exciting examples of successful implementation of GPT or like in digital health in general? So that could be to any of you.
I don't know of any. I know, my kids are using it to write their essays. So that's the most I know about ChatGPT right now. But I think it can help solve some of the documentation challenges for clinicians. On an average shift, an emergency room doctor makes 4,000 clicks on their keyboard. So the workflow of physicians, we often look like clerical entry data people. Mm-hmm. And I think ChatGPT there's an opportunity there to reduce those clerical tasks. And like I said before, 50% of the electronic healthcare records actually duplicated. So it'd be nice if I could just go, hey, here's what I really think is going on with a patient and tell that story. Because often the electronic health record doesn't communicate that story. It's just a bunch of fact or a bunch of data that's repeated over and over again.
Mm-hmm.
Yeah, it's interesting. We've done we're doing a lot with generative AI and ChatGPT in particular. And one of the things you find, and one of the real concerns right now, is in privacy. And obviously, that's a major issue when we're talking about healthcare and any sort of healthcare application. The reality is, though, exactly what you just sort of described. The way of sort of giving it a little bit of information, a little bit of data to really, spit out a whole bunch of details based on what it already knows from a medical perspective. And then honestly, over time, what it would learn from a doctor's point of view, a doctor's philosophy, all of that. I think there's a huge opportunity there to really cross those lines. And truthfully, I mean, AI in general is going to be one of these things that every industry is going to need to contend with. We're in a position right now with our financial clients where, so we're like, okay, you go talk to the legal team. And it's like, all right, well, the legal team's going to have to deal with this at some point too. Like they're going to have to figure out how do we use AI to make our lives easier. So I think there's a lot of opportunity there for sure.
And we have another great question here. Do you see the overall healthcare costs reducing over the course of time if AI/automation continues to improve processes and removes the burden off the healthcare providers/practitioners?
I'll tackle that one. I think that you're going to see an improvement in patient experience is the thing we're really, really after with all of this. Reducing healthcare costs, I'm not seeing it. I think that, we just have in this country, especially all these monoclonal antibodies and new, genetic treatments for diseases, which are all amazing and awesome, but they cost a fortune. So I think we're a long way off from trying to doing much to reduce the overall healthcare costs. But I think we can go a long way to improving the patient experience.
Great. Do you want to do one more or?
Yeah, I think we got time for one more. Let's go.
Okay, cool. How do you get around HIPAA in regards to user research?
I'd actually love to hear this. Bonnie, do you guys want to tackle this, or is this one of those?
That's a Bond question for sure.
We don't talk about this.
I mean, yeah, we want to protect, HIPAA is to, protect confidential medical information. But there are so many aspects of the patient experience that you don't need to release that data. So of course, you should follow the same principles that we do if you do any sort of research in healthcare, right? You anonymize it, you get consent. We have a regulatory body that approves that study. And I think companies can learn from how researchers do work, do funded research, and follow some of those principles, because a lot of times that it's not done because it's very expensive to do. But as we're designing these digital tools that really have the potential to impact millions and millions of lives, I think we in the industry, patients, clinicians are going to demand more sophisticated studies like we do when we're coming up with a new medication, a pharmaceutical drug, a new procedure, to make sure it doesn't do any harm. So, as we're seeing these digital tools that are getting FDA approval, they're demanding that of these digital tools.
And I would expect it as well. And I think is one thing I will say, and I've seen it certainly on, again, the other more sort of retail products that we work with. You see sort of an expectation of feedback loops from customers now, right? It's baked into apps, right? It's like, hey, tell us about your experience, because we know that if you tell us about the experience, that will make the product better. I think it's hilarious. My wife loves filling these things out. It's like her mission in life is to let people know about their products, which I think is hilarious, but it's also really important. It's the only way we make better human experiences is by providing that insight and feedback. So I think that's spot on, Bon. I think that, the more we can leverage the information, the more people get comfortable with it. On the whole, I think you'll end up with a much better patient experience. So there's a good place to wrap it up here, Maddie.
Yeah. So I just wanted to take a second to say thank you again to Bon and Bonnie. That was a great conversation. We will be emailing the webinar recording to everyone that registered, and Bon and Bonnie were kind enough to extend their contact information. So if you have any questions, please feel free to reach out. And thank you for joining. We really appreciate it.
Thank you. Appreciate it.
Thank you.
Have a great one.
Yeah.
Bye.